Hello, my name is Okunoren Oyekenu from California Intercontinental University, USA. I will be talking about the pediatric services in San Diego County, California. An introduction. Healthcare management is a field that requires skills that are learned in medical schools as well as skills learned on the job. Healthcare management is a field that is only managed by medical professionals. Somebody from the computer or telecommunications industry would find it difficult managing a hospital. Healthcare facilities have expertise like doctors who are surgeons, pediatricians, obstetricians, and gynecologists. However, the management of these facilities have been overlooked. Physicians just want to come to do their job and leave the premises. However, if the premises falls apart, then there will be no place for the physicians to practice. Healthcare is not making as much income as other fields like automobile and telecommunication. Individuals can spend as much as $40,000 to $100,000 to buy a single car, or so much money buying as many Android phones and smartphones they can afford. When it comes to healthcare, they will rather look onto Medicaid and Medicare, claiming that they do not have enough funds for healthcare. There is a shortage of physicians and other healthcare expertise. This video is going to explain more about why there is a shortage and how there can be improvement in healthcare. In a survey comprising of 5 people who were Facebook users, in a Facebook group, they were asked, within the past year, have you bought a product or service that you were really excited about? And how many of these products did you buy? And how many were healthcare related? Of the 5 participants, 3 of them bought 1 to 4 items they were really excited about. 1 of them bought 5 to 9 products, and 1 of them bought 10 to 20 products. However, the healthcare related items that these Facebook users bought were only 1 to 4 that were healthcare related. Nobody bought items that were 5 to 9 or 10 to 20 in number that were healthcare related. This goes to show that on events like Black Friday or Cyber Monday, people will be looking out for things like computers, televisions, phones, and other houseware materials, and nobody's thinking of buying a healthcare related item. This study will continue to hold, as these results are just results from a 1-week questionnaire. The reason why Facebook was used to generate the survey was because most people are now social media inclined. If you want to get the attention of consumers, you have to go online, and social media is where you find them. So going on Facebook to ask these questions will help healthcare move forward to know how we can ensure that on days like Black Friday, people come to the hospitals just for checkup and make sure that they get the service at a reduced fee the way other industries have done. I will be talking about the pediatric specialty in San Diego. According to the U.S. Census Bureau 2018, there are 327,167,439 U.S. residents. In San Diego, there are 3,343,364 residents. This makes up just 1.02% of the U.S. population. Of this population, there are 722,000 1,408 residents that are below the age of 18, while of this number, 207,770 are under the age of 5. This population, when they fall ill, they are a special population that cannot just be attended to by any physician. They would require the need of a specialty doctor like a pediatrician. In San Diego, according to the American Academy of Pediatrics 2019, there are about 500 pediatricians in San Diego County. This goes to say that per 100,000 children, there are 69 pediatricians available, and there is only a single pediatrician assigned to 1,445 children. This statistics is alarming. The American Academy of Pediatrics has sectioned San Diego as Chapter 3. It is possible that there are a larger number of pediatricians in other counties. They can be transferred to San Diego. Children need to be immunized. Children need to be checked every now and then, other than immunizations. Below the age of 5 is a risky age for children, and not every child is lucky to go beyond the age of 5. Pediatricians should be welcomed in San Diego County by the government and by the residents. Improvement measures for these statistics are that the number of physicians in pediatric field in the US is only 6% of all specialties. So it is not only San Diego County that is suffering from a lack of pediatricians, but the entire nation, according to Bellerson, Eisenberg, and Hutzbeth, 2016. An improvement measure can be that medical students and the government should be made aware of the statistics to enable them make wise choices to increase the number of physicians. When enrolling in medical school, students can consider that at the end of the program, they want to be pediatricians. This would increase the number, as well as the government paying for the training of the students. Nearby counties that have higher ratio of pediatricians can be asked to release some staff to counties that have shortages. In conclusion, healthcare services should not depend on Medicare and Medicaid alone, but can source for funds from charitable organizations to pay the bills for patients who cannot afford treatment. On days like Black Friday, for instance, and Thanksgiving, Giving Tuesday, hospital services can be made to be 50% of the regular prices, and people for no reason or any reason can just decide to walk into the hospital to check if they are healthy. Blood pressures can be measured at free price. Every other service that comes at an expensive rate can be given at reduced rate. The government should provide funds for training staff to increase the number of pediatricians in their county. Thank you for listening, and the references are from American Academy of Pediatrics 2019, Bellerson, Eisenberg, and Hubbard 2016, as well as the U.S. Census Bureau.